Welcome everybody to the third webinar in this series of psychosocial support in emergencies webinars. We're very happy to have you on board today. And today is Eliza Cheung, who will be presenting from Hong Kong Red Cross. Eliza is also a roster member at the PS Center, and she also works as the part-time technical advisor for the PS Center. So Eliza is really well known to most of us, and she has furthermore has had many operations where she's been the psychosocial delegate. For this webinar today, we're going to talk about setting up and running psychosocial activities in the unit, in the ERU unit. And we have asked Eliza to focus on the two big, large-scale operations that has taken place in the recent years. One of the operations was in Nepal after the big earthquake. And also, Eliza will be talking about the Bangladesh population movement that started in 2017. The background of Eliza is as a clinical psychologist, and she is a specialist in psychosocial support. And she furthermore is a specialist within the area of disaster mental health and psychological first aid. The structure for today of the webinar is that Eliza will talk for about 20 minutes, and then there will be 8 minutes for questions. So we ask you to not only mute your microphone, but also to type up your questions in the field. There's a field where you can type in questions in your browser, and then we will collect the questions and get back to you. So over to you, Eliza. I will mute my mic and you will go on.
Okay, hi everyone. So good morning, afternoon, and evening to everyone, depending on where you're located on Earth at this moment. So I'm happy to share with you on the topic of today, setting up and running the psychosocial unit in an ERU. So in my previous deployments, I myself and I also assisted some other PSS delegates to set up the PSS activities within the ERU, like at the clinics, during outreach, or at like some transit center. So, of course, I know a lot of participants attending today, we do understand the importance of needs assessment. So we know that we have to make sure needs assessment of mental health and psychosocial support are conducted, and we draw from the results to design our field PSS activities. So previously, some speakers at this webinar series mentioned about the M&E framework, the monitoring and evaluation framework published by the PS Center. This is, of course, an excellent reference to look at. I like it very much. Nevertheless, when sometimes some thorough and detailed assessment may not be possible given the context, rapid assessment involving some, like a few questions may also help. So this rapid assessment guide for psychosocial support and violence prevention in emergencies and recovery, this document provides very like good reference. There are some selected questions for you. And I also found this guide very useful, and I also use it a lot when I'm in the field. So another very important role as a PSS delegate when you're in the ERU is the recruitment and the training of your volunteers and translators. I think this is definitely one of the most important things when you're working in the field, because you're not working alone by yourself, but you're working with a team of people. And the best scenario would be you're working with people who can speak the language, who know the culture. So when I was in Nepal, I was really lucky to have some social worker students who know fluent English to work together with me. And even in Bangladesh, which I was deployed in October last year, when we are setting up the child-friendly space, we are able to find some local people from Rakhine who used to be teachers or students studying in psychology to come and join our PSS activities. So that scenario is like perfect, because especially when you're working in an ERU, when you know that there is like a certain time frame for you to work in the field, you really want to build the local capacity, and it is no better way for you to work together with the local people. And sometimes when you're first deployed in the field, you may also be involved in the site selection. Selecting a place where you're able to set up the PSS activities would be really important. You want to make sure that it is safe and it is accessible for the people. And sometimes it is not so easy to find both. For example, in Bangladesh, we are lucky to find a place, a piece of land to set up our CFS, where we have the water tape just in front of it. So we are able to do, and we are able to educate the participants of some hand washing and also doing some hygiene promotion, and also doing it together with the public health delegates in the field. And when situation is you cannot find running water, like in Nepal, we also set up some water tanks for the hand washing. And sometimes the site selection may you have to change according to the changes in the land use after the emergency. So at first, maybe you can find a safe place which is located away from the road, but because of the changes, you may also have to move your activities accordingly. So I think this is also something that I learned from my previous deployments. So when we talk about the PSS activities in the field, while we usually start our PSS activities at some ERU clinics, hospitals, or other physical setup, I would say for PSSIE activities, we can go beyond that and even more into the community. Like, for example, when I was in Nepal, together with the PSS volunteers and translators, we put together a puppet drama psychoeducation, with the content of it comprised of various stress reactions and coping mechanisms. And we went to a number of different schools or some temporary schools within 2 hours of drive from our base. And we provide this psychoeducation to over 500 children in the neighborhood. Of course, we do launch PSSIE activities within the ERU setup. We work closely with the teams at the clinics, at the field hospitals, and also with some other profiles like protection and community engagement. Sometimes individuals presented with MHPSS needs were also referred to receive more support. Like in Nepal, the doctors and nurses, they will refer patients who present with the MHPSS needs to for more like PSS support. We have children who lost their weight significantly after the earthquake, or children who presented with a lot of like functional difficulties after the earthquake, and they also benefit from engaging in our PSS activities. So in that sense, we work like collaboratively with the clinics and the field hospital. So my points here are simple. So ERU setting is like the base, and our PSS activities should be launched there and beyond. And sometimes some people may have this misconception about PSS activities, that we only like play with children and do something fun. I would say this is not exactly true. When we design PSS activities, we do make sure that they have the psychosocial elements and considerations behind them. We have our reasons to back us up to do or not to do something. For example, in Bangladesh, when we were setting up the child-friendly space, we make sure that we ask children to draw picture. We do not ask them to draw the violence they encountered before, because that could cause secondary trauma to them. And when we plan for the opening hours of the child-friendly space, We also decided to make it a schedule and also draw the opening hours outside the tent. Children then have the sense of regularity and normalcy. And this also gives them something to look forward to every single day. So in terms of the Hopeful's principles, I think we are familiar with that. This is what the element hope stands for when we are working in the field. And also PSS activities do not only target children. We do provide support to adults as well. For example, in Cox's Bazar in Bangladesh, the women's group and the men's support groups, they are highly appreciated by the people in the community. Some participants told us that merely the fact that they could sit together, they can talk, learn some new things, learn about like stress and coping and support each other. This was already an amazing thing to them. This does not only improve their psychological well-being, but also enhance their like social network and also their wellness. So some of the women that we met, quite a number of them lost their husbands, and they reported some difficulties of taking care of the entire family when they themselves also experienced a lot of different like stress reactions. They could not sleep at night, or they had nightmares, and then they had difficulty going back to rest after that. And during daytime, they have to go to like different distribution points and then to cater for their family. And it is really useful for them, according to what they say, to learn about different kinds of like coping skills that they can take care of themselves first, and then they can take care of their family. So this is also some of the PSS activities that we do in the field. Regarding evaluation, I think one of the useful way to show the impact of our work in the field is to engage in meaningful evaluation. Some people may feel that this is the difficult part, or they do not really know how to do it. To me, I think this is both about the mindset and also the technical skills related to that. Some speakers in the earlier webinars of this series mentioned about the competency framework of PSS delegates published by the PS Center. And if you read through it carefully, towards the end of this document, there is a useful section on the outcome indicators of PSS-IE activities. This is something that I would recommend PSS delegates to read and use it during the deployment. And I also use it when I was in the field. And when I was in Nepal, my colleague and I also did an evaluation of the child-friendly space activities using some child-led indicators that we developed from the focus group discussions. So we asked the children in the focus group discussion that what are some of the things that you see if you think this person is getting better after the earthquake. So they give us the idea of, oh, if someone is having less nightmares, they are less fearful during the aftershocks, or they relate well with people and teachers and other children, then that would be something they understand is like an indicator showing the positive change. So we also use this kind of like child-led indicators to evaluate the activities in the CFS. And the group of children who participated actively in our CFS joined in the evaluation, and that also provide us with some evidence showcasing the impact of our work. So sometimes it is as simple as just asking the participants to indicate their feelings using the scale of emotions, ranging from like very happy to very sad. And just like the puppet drama psychoeducation we mentioned earlier, we asked the participants how much they appreciate the story by rating the levels of happy face, and we also asked them how did they learn during the process, and by capturing their feedback, this is already part of the evaluation that we did. So that's why to me is not just about the technical skills, but it's also like the mindset. Whenever we launch the activities, we are also thinking of ways how to capture the impact or the effectiveness of our activities. So another thing I would say is also very essential for the PSS delegates in the ERU setting to do is to mainstreaming the PSS elements into other sectors. Earlier on in our first webinar, Zara also mentioned about the like some of the documents that we prepared so that we are able to mainstream the PSS into other sectors, and we also educate people how to talk about psychosocial support. It's easy because sometimes it's not so formal, because you can talk to your colleagues during your lunch breaks or your dinner breaks. You can tell them or discuss with them some of the like the PSS concerns when they are working in different sectors, like in health or in relief distribution or even in shelter. How do you care for people's mental health and psychosocial well-being? How do you make sure that the protection issues are covered? So these are some of the things that I would say for the PSS delegates within the ERU, you can always do, not just within your work hours, but also in some other less formal situations. You're able to like advocate for the importance of PSS also in other sectors, in other profiles. So I would say I try to sum up like for PSS delegates when you're working in the field, starting from needs assessment, from the site selection, and all the way to when you're designing your activities, when you're conducting your evaluations. So I hope to give like I would say a brief summary of the scope of the work of PSS delegates in the field, and I'm looking forward if you have any questions that maybe we can like discuss together, or you have other experience to share, because I believe we also have a group of people who are also experienced in doing PSS activities in the field.
Thank you, Eliza. That was very interesting. What a lot of points and what a lot of things to comment on. And there's one question, which is just a comment when there's somebody asking for the link. And let me just give you all the message that all the links for the webinars are at the PS Center website. We'll type the address at the end so that you can find it. However, Eliza, I'd like to go back to when you talked about selection of volunteers and interpreters right from the beginning. Did you use any criteria? I was just curious about that.
Yes, this is really something you have to consider when you're doing the recruitment or the selection of the volunteers. Of course, if you do have a group of or a pool of potential volunteers, it is possible for you to see if they have any pre-existing like knowledge or experience in conducting PSS activities earlier on. So you can definitely select the best person for the job if it's possible. However, it is not always the case. When we were back in Bangladesh a couple months ago, when different sectors and different activities are literally fighting for volunteers, sometimes it's really difficult. I would say, of course, we have some basic standard, like whenever we try to train the volunteers, we have to make sure that they understand issues about child protection and like other different topics. But then their interest and also their commitment into doing PSS activities, I would say, in my opinion, would be even more important, because in some situations, we are facing with a group of volunteers who do not really have any PSS experience before. But then if they are willing to learn and also they are committed in PSS activities, or they see the value of it, then that would make a huge difference. And after the selection, after the recruitment, the training part is our duties. So we have to equip with them, like the technique, the skills, and also the right attitude when they are working in the PSS activities.
Thank you. Another question is, when we talked about setting up the activities within the ERU, are there any activities that you have set up where the psychosocial people are supporting the health staff, namely in taking care of the psychosocial needs, not only when people are referred? So could you elaborate on that, Eliza?
Yes, of course. Yeah. When you're working in some like health settings like the clinic and field hospitals, and you can definitely see that sometimes your colleagues are also facing a lot of different stressors every single day. So we have also tried to do some program that is more like caring for the carers, some exercise or some stress management sessions that we can do it as a group. And this is also something that it can enhance the team spirit and also the caring, like the culture within the team. But we also have to be aware of the situation that actually for the PSS delegates being deployed within the ERU, our primary role is to support the beneficiaries, and we are not deployed mainly to support our like fellow colleagues, but of course, like if needed or if instructed by the team leaders in some like critical situations, then we may also provide like PSS directly to our fellow colleagues. And also if needed, we can also discuss together with the team head, and maybe we can deploy stress counselors. We can deploy like special delegates coming in mainly to support our fellow delegates in times of some like critical moments. So this is something that I've done that before, and this is also something that we could see that in the field.
Great. And I have a few questions coming, and I've seen all your questions to all of you out there, but I'm going along with, there's a question about how to take care of volunteers in a very difficult situation when they are affected themselves. And could you talk about that, how you did that? And the question is said about how you did it after the Nepal earthquake.
Yeah, right. This is a really good question. Thank you. Definitely, this is something we have to like be aware of, because some of my volunteers working closely with me, they also lost their house or lost some of their family members during the earthquake. And even in Bangladesh, some of my volunteers, because they have to work for quite an extended period of time, they also are facing a lot of different stressors. Of course, like there's something that as a PSS delegate, you can do by engaging them in some of the like sessions, debriefing sessions, or some stress management sessions together. And I would say it is also very beneficial when you can also advocate their well-being on behalf of them. By talking to the HR to make sure that they have enough rest days, and also they are like have the proper rotation, so that they are not being involved in the most stressful positions all the time, but they have the chance to like try different activities in the field, and then they have proper rest. And these are, I would say, it's not just purely just PSS activities, but you also have to work together with some other sectors and some other elements in the operation, like the management, like the HR personnel, to make sure that they are really working in a setting that also promote their own well-being.
Great. And there's a very short question, follow up on that, and then we'll leave that. It's Dewinder from Yemen who's asking if there are any standard packages for care for staff and volunteers. Over to you.
Okay, so any package that for caring for staff and volunteers. Well, in the PS Center, we do have the guidelines, we do have the menu, caring for volunteers, established, published, and there are like fantastic exercises and trainings and like nooks for management or like personnel people for them to take reference. So this is also one of the trainings that is really popular within the PS Center. So I would say I would recommend you to have a look of this guideline.
Great. That was a short answer. We have questions on baseline and another one on exit strategy, just to prepare you for what's coming. So the first one is directly to you from Hans. So from Danish Red Cross, if you ever conducted a baseline survey or rolling evaluation based on thorough questionnaires, and if you've done that in an emergency setting.
Yeah, the guides that I mentioned earlier, the rapid assessment for the psychosocial support and the violence prevention in emergency and recovery, that guide that I mentioned earlier, I have been using that a lot when I'm doing the baseline assessment. And sometimes it's not just like the overall baseline, but maybe before you are launching some PSS activities in that neighborhood, you want to know the capacity of this neighborhood, and you also want to know the specific concerns and needs of the people. Then there are quite a number of questions that I found really useful when I'm talking to the community. And sometimes I also tag along with the mobile health clinics when they are like reaching different more remote communities in the neighborhood, that I'm able to also take the chance to talk to the community and then use the some of the questions that I found in the rapid assessment. So hence you just clarify that whether you have done something beyond a rapid assessment. For baseline one, I have not really done a comprehensive like the fact assessment before, so I may not be able to answer that question. Is that right?
Okay, that's fine, because we're talking about the ERU, which is the emergency response, so maybe that would come later. But there's a question from Chuki about exit strategy. Could you maybe talk a bit about the exit strategy that you've been involved in and how you hand it over to somebody coming in to finalize ERU and then to hand over to the National Society?
Right. Yeah, so the exit strategy, actually, like when I was deployed in Nepal, I was in the second rotation that time. And we do not really, I mean, back then, we did not really know whether we had the third rotation of PSS delegates coming in or not. And eventually, it turned out that we are not having the third rotation anymore. So actually, I started the planning for the exit strategy probably the second week that I went into the field, and because we at that time we had PSS activities that within a village, within the neighborhood, and then is next to a school and also next to the clinic. So together with the team leader, we discussed and we also have like a lot of meetings with the local Red Cross chapters. We have meetings with the local schools to discuss some of the ways for continuing some of the PSS activities after the ERU. So we discussed about handover of some of the materials that we had, like our the child-friendly space tents, and also we have the some of the equipments, and also some of the like the volunteers that we trained. We also discussed with the local community whether or not they would like to continue the PSS program, and like in what format that they would like to continue. So after these discussions, after we discuss the plans of handling different like these materials, and we also provide trainings to the school, because like eventually we decided to hand over our activities and our equipment to a school in the neighborhood. So we also provided training to the teachers there how to run the PSS activities. So in that sense, we are able to continue some of our program after the ERU has to exit.
Very interesting. Thank you. I'm glad we managed to exit strategy to get that, and also this is a time to exit This is the time to exit the webinar because our time is up, and thank you very much for the questions. A few of them have not been answered, but we can type in the answers to you if you stay on a few seconds, because they are related to things that are about Red Cross and how we work. And I'd like to not only thank you and thank the listeners, but also to remind you that the final webinar in this series will be on the added value of psychosocial support for coordinators in emergency operations. So even if it's not directed for you out there who are practitioners and theoreticians in the field, it can be nice to hear what the managers and what the head of operations are saying. Tina Zarikoski, who is a senior officer in public health and emergencies in IFRC in Geneva, who's also head of operations, will talk on the added value that she sees in having psychosocial support integrated into an emergency. It's on 14th March. And please stay tuned for that. And remember that you can listen to the rest of the webinars go through our website. At our website, you will also find all the material that Eliza has talked about today, the M&E toolkit, where the short violence prevention and PSS assessment is integrated, in fact, as well as the caring for volunteers and the competency framework. So thank you very much for your participation, and thank you to our presenter. On behalf of IFRC Geneva and IFRC PS Center in Copenhagen, goodbye, and we hope to hear from you another time.